Hello, dear colleagues. Thank you for inviting me to this conference and giving me the opportunity to make my presentation of our research. Today, I'm going to talk about improvement of aspects of subjective sleep quality of healthy volunteers by ingestion of porcine placental extract, a randomized crossover pilot study. The details of the study were published in the Swiss journal Frontiers in Nutrition. Introduction. Getting sufficient sleep is crucial for healthy life of all people, especially in the modern world. Insufficient sleep has become recognized as a cause of a variety of health problems. For example, insufficient sleep affects the autonomic activity, which possibly leads to depression, diabetes, hypertension, and so on. Therefore, improvement of sleep is important to prevent such a variety of health troubles. However, because hypnotic drugs have inherent risks of side effects, other ways to improve sleep are needed. One such way is taking food materials having a property of improving sleep. In this present study, we focused on porcine placenta extract, PPE, as the food material having the potential to improve sleep. Recent studies on PPE showed that symptoms associated with menopausal women could be improved by the ingestion of PPE. Because menopausal symptoms include sleep problems, we thought that sleep problems are potential target to be improved by PPE ingestion. Materials and methods, study design and subjects. This was a multi-center, randomized, double-blind, placebo-controlled pilot study under crossover setting conducted between March 2017 and July 2018. 32 men and women aged 20 years or older who were dissatisfied with their sleep but had no underlying medical conditions and were not being treated were included. Subject sleep status was assessed with Pittsburgh Sleep Questionnaire. Test sample. The test samples, both PPE and placebo, used in this study were the same soft capsules reported previously, and the dose of PPE was 300 milligrams per day. And subjects were randomly assigned to two groups, each of which received placebo or PPE containing test samples daily for 2 weeks. A crossover design was used with a 2-week washout period before the other test sample was taken. The group that received the placebo first was designated as a placebo first group, and the group that received the PPE first was designated as a PPE first group. Measurement. Object measurements of the sleep made with an activity tracker and subjective measurements of sleep quality by use of St. Mary's Hospital Sleep Questionnaire were done just before and after administration time slots. And this questionnaire evaluates the the state of sleep within 24 hours by answering 14 questions about a single sleep. Statistically significant differences in each endpoint of sleep between groups and before and after the intake of study materials were determined by Wilcoxon's signed lung test, and statistically significant differences in subject background between groups were determined by Wilcoxon's lung sum test, were considered statistically significant when the significance probability was p less than 0.05. And initially, there were 32 participants, but eventually 25 completed the study. However, due to missing data in 5 of the participants, data analysis was performed on the results of the final 20 participants. Our results. No significant differences were detected between PPE first and placebo first groups regarding the age or PSQI global score at either screening or analysis. Our results. No effect of PPE on the sleep length was observed. However, several measurements in the subjective St. Mary's Hospital Sleep Questionnaire, that is, changes in Q5 sleep depth and Q9 sleep wellness between pre and post-injection, were significantly different between groups in the direction of improvement of subjective sleep quality in the PPE group. Regarding the difference between pre and post-treatment, in addition to Q5 and Q9, sleep satisfaction Q11 was also significantly improved only in the PPE group, although not significant between placebo and PPE group. Here's graphical representation. The PPE group had significantly deeper subjective sleep and a higher sense of sound sleep compared to the placebo group. Discussion. In this study, we for the first time demonstrated with a pilot clinical study that 2-week daily ingestion of PPE, 300 milligrams per day, significantly improved aspects of subjective sleep quality of healthy subjects who were not satisfied with their sleep compared with that of the placebo. It is not clear at this time that PPE truly could not improve objective sleep quality because, unfortunately, the activity tracker could calculate only total sleep and the ratio of deep sleep to total sleep. Based on these results, some yet unknown ingredients in PPE might act centrally in a direct or indirect manner to alleviate the feeling of unwellness in the case of menopausal symptoms and sleep, even if their objective aspects are not improved. Elucidation of such responsible factors in PPE and the underlying mechanism are challenges for the future. That's all for my presentation. Thank you for your attention.